City News everywhere.
Today, I'm pleased to confirm that Manitoba Health is expanding COVID-19 vaccine eligibility to include children aged 6 months to 4 years of age.
It's news some Manitoba parents have been waiting years for, the province approving the use of Moderna in children under the age of 4.
While we will have enough vaccine for all children in the near future, our initial delivery is limited to 14,900 doses, which means we will have to initially prioritize who can get these initial doses.
Manitoba's top doctor says doses will be heading to vaccination sites, public health offices, and clinics after they arrive in Manitoba at the end of this week, and appointments can begin to be booked on Monday the 25th at 8 a.m. The list of those eligible for first doses includes First Nation, Inuit and Métis children, and all other children who meet certain medical conditions like airway abnormalities or chronic diseases.
If your child doesn't fit these initial criteria, again, we reassure you that we should be receiving more doses in the near future. By the end of this month or early August is what we're expecting.
Hopefully the kids can get it before the school season starts again in September.
Healthcare worker Bethany Campbell was elated to hear the news that her 2- and 4-year-old children are now eligible for vaccination.
I've been working with COVID patients for the last couple months, or I guess a year. Since I started working at a different hospital, and so now that they can get vaccinated, I'm very excited.
What kind of feeling does that give you?
A good feeling.
Yeah? So you're excited to be vaccinated?
Mm-hmm.
Dr. Rusin says the vaccine for children has a very safe profile and is effective, providing a strong immune response. Manitoba Health Coalition Director Thomas Linner was also encouraged by today's news, but wanted to see an emphasis put on 4th doses for Manitobans.
What Dr. Rusin said today in his press conference should be very concerning to all Manitobans.
He says with Alberta, Ontario, and Quebec all opening up access to a 4th dose, Manitobans are being left behind. Dr. Rusin claims this is because the province is looking forward to a potential new vaccine.
In early fall, there's a real chance of a bivalent vaccine that we begin our fall campaign with that is going to be very likely more effective against the newer variants that we're dealing with. And because there's going to be a 3 to 6 month interval between doses, a large 4th dose campaign right now could potentially delay the receipt of a much possibly better vaccine in fall.
I think that is indicative of an approach that has not recognized the impact of COVID-19 on our hospitals, our clinics, our personal care home, and the frontline workers who staff those facilities.
Rusin says the BA.5 variant currently makes up roughly half of sequenced COVID cases in Manitoba and anticipates that to increase, saying it's likely more infectious. Rusin says they can't take public health interventions off the table, but currently have no plans to bring them back as of now. In Winnipeg, Mike Albanese, City News.